It's Thursday, the 11th of March 2021, the day COVID-19 was declared a pandemic and the eve of the first anniversary of first cases in Ghana. This is the Midday News. And we're live from digital address GA0993341 and available on Joy 99.7 FM here in Accra. It's also live on Love 99.5 FM in Kumasi and affiliates across Ghana, including ATL FM in Cape Coast, Garcia FM in Techiman, and Dreams FM in Bogatanga. You can download the My Joy online app from Play Store and App Store for iOS users to listen live on the internet. In this edition, death toll in the Sunday beach party disaster in Apam rises to 13. We'll take you live there as families of two more teenagers suspected to have joined their friends to the beach party also report them missing.
Just today, two other families have reported of missing kids.
We have details of that also coming up.
We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
A year of fear, restrictions, pain and sorrow, but also of creativity, successes and triumphs to overcome a public health emergency, the coronavirus pandemic today. Joy News brings you COVID a year on, special broadcast focusing on how the country has been impacted since the outbreak of this highly infectious disease.
Fellow Ghanaians, good evening. I've come to your homes once again, as promised, on the matter which continues to grip not only the attention of the nation, but also of the entire world, the coronavirus pandemic.
We also have the rare experience of a member of parliament who paralyzed after contracting the virus, plus the many efforts Ghanaians put in to bring the situation under control.
Anything I needed to do, somebody needed to carry me. If I wanted to use the bathroom, if I want to do anything, and it was very terrifying.
We also hear a government recovery plan following months of schools closure, which has left some institutions in financial distress and backlog of academic work. In sports.
A year on after Ghana recorded their first case, we'll be hearing from the Ghana Swimming Association on how COVID-19 has affected their activities.
And I'll also take you to Parliament, where there are preparations for the presentation of the 2021 budget statement and economic policy of the government. We'll bring you update of that and more here on the Midday News with me, Emefa Apau. Thanks for making time to be with us. We are your home of independent, fearless, and credible journalism. And for 1 year, our lives have changed in a way we never imagined. The outbreak of COVID-19 in Ghana meant the imposition of restrictions, including lockdowns, shutdown of schools, churches, mosques and businesses, leading to collapse of businesses and, of course, job losses. Our social lives have been shattered. No more shaking of hands, no more hugs as social distancing rules kicked in. Funerals, weddings and other social events all restricted in an attempt to hold the spread of a highly infectious COVID-19 virus, which has so far infected nearly 87,000 people and claimed 656 lives here in Ghana. Ahead of the commemoration of the country's first cases, Joy News brings you special broadcast looking back at how Ghanaians have been impacted in our collective effort to end the pandemic. Here's head of our health desk, Fred Smith, with reflections. I'll bring you that shortly, but you can follow the conversation on our social media platforms as well as our social special reports on myjoyonline.com with the hashtag COVID a year on. But education was one of the areas severely affected. Schools were closed, leading to job losses and a change in the mode of teaching and learning. Beryl Ernestina Richter looks at this area in this report read to you.
On March 23, 2020, And following the West African Examination Council's decision to indefinitely postpone West African Senior High School Certificate Examination, WASSCE, the Ghana Education Service directed schools to release the JHS and SHS 3 students to go home until the President's directives were reversed. President Akufo-Addo also directed the Ministry of Education and the Ministry of Communications to ensure that they roll out distance and remote learning programs for all students. Charlotte Hesse is a guardian in Accra.
The smaller one, she's in class 1. They've been doing Ghana learning radio all over the country.
Nadine Fans is a nursing mother and a banker. Her Wards school was one of the few schools in the capital to roll out the virtual learning program during the closure.
When the virtual learning started, I was actually on maternity leave. I was already home with the kids. But the additional responsibility of having to teach them at home was so much for me because I had a new baby. And, you know, getting new babies are already, a whole package before you add the virtual learning. So it was really stressful for me.
A report published by Child Rights International, a non-governmental organization, in November 2020 stated that 6 out of every 10 children said they used peer and parental support in learning.
I remember one of the days, my little one, he's in KG2, they were treating types of soils. And understanding the whole concept of loamy soil, sandy soil, it was so abstract to him.
That's Ernestina Beryl-Richter's report read to you. And as schools reopened, children were introduced to new ways of life. They had to stay distant from their mates, wear face masks, and more strangely enough, they had to now take breaks to go and breathe. Judith Awotretando has that report.
Ever imagined a time when breathing freely will be such a luxury? Well, it is in this time of coronavirus. Here in the youngsters' school, children are given breaks just to breathe. It is called breathing breaks. Children are told to be socially distanced so they can breathe. Wearing of masks is now one of the COVID-19 preventive protocols, but it is not easy for children who are also required to wear masks, especially in schools.
My nose mask, I always feel hot and I cannot even breathe. I'm always stuck at one place and they always send me here. And because of my mask, our teachers also said we shouldn't remove it.
Yeah, it's very difficult because sometimes the heat in the mask, it makes some people collapse. It's very difficult because sometimes I can't breathe properly.
For teachers who cater for children in the lower primary level, it is even more difficult managing them. Lily Mensah is teacher at the youngsters' school.
It hasn't been easy. It's been a very tough situation for us here. Since the pandemic started, you have to encourage the children to put on their nose masks all the time. Because most of the time, the children will come and they'll be comparing their nose masks with each other, even with the use of the hand sanitizers. If you are not careful with it, some might end up applying the hand sanitizers all over their face. And that is the worst thing of all, because if it gets in contact with their eyes, you, the teacher, you are in a very big trouble. At the same time, it is going to affect the child forever. So this has been one of the aspects of the sanitizers, which we, the parents, should also take in charge of in their house. Because if you are to give your child a sanitizer and you don't educate him or her on how to use it very well, it will rather pose a problem to you.
Although it's only for a short time, the kids seem very excited about this part of the day.
There are breathing breaks. And when you are in their classroom and they are supposed to answer questions in class, they can bring it down a little bit and answer the question in their classroom. At least that will also enable them to get some fresh air, because it's not easy for them. Likewise, with the teachers teaching, it's very difficult in it when you are speaking for a very long period of time.
It is unsure when this virus would finally disappear, but one thing is for sure, that kids can't wait for that to happen. Judith Awotretando, Joy News.
Well, Education Minister Dr. Yawose Educhum has been speaking to Joy News' Gifty and Apia about government's plan for recovery following months of school shutdown and restrictions which have affected smooth operation of some institutions, especially those in the private sector. I'll bring that to you shortly. But first, reflections from the head of our health desk, Fred Smith.
was before this.
The Ministry of Health has confirmed 2 cases of COVID-19.
Then the fears of a lockdown.
We know that we will not be infected with COVID-19.
But it came anyway.
I've imposed restrictions on movement of persons in the Greater Accra metropolitan area and the Greater Kumasi metropolitan area.
Many had their concerns.
The implementation will be good for us. But the thing is, due to financial circumstances, family, if you are not going, are they going to cope? The government have to look at it.
By now, you get to your junction around even 7:30 and you have to wait for 1 hour, 2 hours before you can get the car. So our employers have to cope with that.
But this measure remained in force.
All public gatherings, including conferences, workshops, funerals, festivals, political rallies, sporting events, and religious events such as services in churches and mosques have been suspended.
In fact, Ghana and the world has remained so.
All our borders, that is by land, sea, and air, will be closed to human traffic for the next 2 weeks.
A year on, COVID-19 remains.
Reflections from the head of our health desk, Fred Smith. I'll bring you that interview with Dr. Yawose Educhum shortly. But let's focus on the account of some COVID-19 survivors. MP for Adaklu in the Volta region, Governor Kwame Agboja, was left paralyzed for 2 weeks and nearly died after recovering from COVID.
After a period of time, I got cured or became COVID negative. So I was discharged. I went home late afternoon, slept. In the night, I felt like using the washroom. When I got up from my bed, I couldn't stand on my leg. Apparently, I had a post-COVID syndrome. My legs were numb. I couldn't use them. So for about 2 weeks, anything I needed to do, somebody needed to carry me. If I want to use the bathroom, if I want to do anything. And it was very terrifying. So it took hard work. By that time, I wasn't at the hospital anymore. I was at home. Hard work of very diligent healthcare practitioners to be able to help me with medication and physiotherapy.
So as we observe a year of COVID in Ghana, thankfully, the MP for Adaklu, Mr. Kwame Agboja, joins us on the line. So sorry to hear about your experience, but I'd like to first find out how you're doing now.
Hello.
I'm asking how you're doing now. Much better.
Oh, I'm doing great. I'm doing great by the grace of God.
But how did it happen that you recovered and then you were left paralyzed for 2 weeks? Tell us exactly what happened.
Well, I just want to use this opportunity to thank the Almighty God, the medical staff, and friends and family that managed to rescue me from COVID. And I want to tell my compatriots in the country, COVID is real. Don't ever think there's anything that I can protect you from COVID except to do the things that the WHO and the ministry put out, the social distancing, washing of hands and everything. I thought I was doing well. I think after the swearing in of Parliament, a few days after that, I went to my constituency and I started feeling a bit unwell. So I returned to Accra, went to my doctor. He gave me some medication. I went home. 5 days after that, I realized I didn't get any improvement at all in the medications I took. So I went back. So he suggested other medications. I went out for the medication. But that particular day, I realized I was feeling a bit more terrible. So I was with a friend, and he asked me whether I've been coughing. I said no. Whether my temperature has been going up. I said no. He said, well, there's nothing, no harm in trying. So let's go and do COVID test. So we did a test, and it was positive. And I could tell I was feeling more and more sick, and then my breath was beginning to be insufficient. So I made some calls, and I was told to proceed immediately to Ghana East Hospital. I went and met a very wonderful medical staff Dr. Comey, Dr. O, and the nurses and everything. Yeah. And I was admitted. That particular night wasn't easy. I was put on oxygen and everything. It was terrible, one of the most terrible nights. So I took a couple of days, about a week. I was being attended to intensively.
Okay.
Let me just summarize. So after a number of days, my condition improved and I tested negative. So I was discharged. I went home that evening. Went to bed. In fact, when I was at the hospital, I couldn't eat at all. So I was very anemic. There was a week during my sickness that I couldn't eat anything at all. I couldn't drink. Even I take any food, tastes like sawdust. So I couldn't eat anything. When water enters my mouth, I would throw up for 15 minutes. So I hated food and everything. So I was very anemic. So I went to bed that day, and somewhere along the line, I felt like using the washroom. I just realized I couldn't get up. So I thought it was a joke. I tried, I couldn't get up. So I have to crawl from my bed to the bathroom. And I shared this in my constituency as well. So people will know the reality about COVID. That is not everybody that will say, I've got a headache.
Yeah.
And then few days it clears. Some people, as we are all aware, people lost their lives. People are still nursing the effects of COVID, though they are not COVID positive today.
Okay.
And for the next 2 weeks, I have to depend heavily on my physio people and my physicians and friends to basically lift me to the bathroom and everything.
Well, and thankfully, you are back in Parliament now and doing well.
Yeah.
Well, that's a real survivor story, and that's an MP for Adaklu. You know by now that COVID knows no class nor race. COVID is real, and the hashtag is COVID a year on. You just heard the MP for Adaklu in the Volta region governs Kwame Agboja there. Now, at the peak of the pandemic in June 2020, a pregnant woman diagnosed with COVID-19 successfully delivered at the Elwak Level 2 COVID-19 Isolation and Treatment Center. Medical research is yet to establish if pregnant women with COVID-19 are at any risk of becoming seriously ill than other adults with the condition. As the country marks a year since the outbreak of the pandemic, joining us is Beryl Ernestina Richter gives us a recap of how the process went.
It is 12 p.m. at the Elwak Isolation Center, where about 30 persons with COVID-19 are being kept and treated. 2 of them are pregnant, and one of them, who does not want to be identified, is about to go through a cesarean section she had arranged for earlier. It's a few minutes to the procedure. The medical team, clothed fully in their PPEs, ready themselves, tightening all loose ends. Unlike other surgeries they have done, this one requires leaving nothing to chance.
We are joined by Lieutenant Colonel Asari.
What does it all entail? As you can see, we are all in our PPEs as well, knowing quite well that we are going to deal with a condition that is highly infectious as well. So the patient will come in here, and then we will clean the back. After cleaning the back, one of my team members here will now give what we call a spinal anesthesia. And in this case, we are just going to instill some few mils of a local anesthetic agent into the back. And that will numb her from the nipple downwards.
Lieutenant Colonel Michael Asari is an anesthetist and will be supported in today's surgery by obstetrician gynecologist Lieutenant Colonel Frederick Ajarijan.
It's been days. We've been planning all of this out for a couple of days. We've spoken to all the teams. We brought in clinical psychologists to speak to the patients. We have pediatricians who are on standby and will be present in theater if there's any requirements for that purpose, because we are not working in normal hospital environment.
Well, we all know how hard education was hit. Dr. Yawasi Educhum, Minister for Education, has been speaking to my colleague Gifty Andwapia.
What is our recovery plan in terms of the impacts that COVID has had on the education sector? Walk us through the plan towards recovery.
You really have to appreciate the fact that COVID-19 and education have become strange bedfellows. They have to coexist. And in the midst of that, you have to begin to look at what is called learning loss. Before COVID-19, the World Bank has something that they call learning poverty. And they said in developing countries, 53% of your 10-year cannot read for understanding. And now they are saying it's become worse for certain countries because they stayed at home for 1 year. And the learning poverty rate in some countries is about 90%. I see if you don't get to the root of the problem, you cannot attack it and you cannot really solve the problem. So this year we have started a national standards assessment. It's a national exams like BEC for all fourth graders across the country. Every fourth grader in Ghana will take a BECE-like exams, but in just English and mathematics. And that will give us the critical data to see where our students are and how we pick up the pieces and truly get them to recover.
Education Minister Dr. Yao Osei-Aduchum and Michael Anrichta Anderson Nye has been looking at how churches were also impacted.
Father, stretch forth your hand and bring healing to these ones that have been infested. In the name of Jesus.
For several weeks, churches remained closed. Pastors couldn't see their members.
When I have to stand on the microphone and I'm preaching to empty seats, I don't see the people I see always, hug, fellowship. It's very emotional for me.
COVID-19 had suddenly erected a barrier between them and their members. Bishop Charles Ajinasara of Perez Chapel International talks about the impact of COVID on his church.
For most of the churches in Ghana, we are used to dealing with the people. They come in their numbers, and even though there were a few online platforms, but we weren't taking advantage of it, and then suddenly COVID comes.
This unleashed serious financial burden on the churches. Coffers of some churches started getting depleted. Some had to devise ways of getting members to at least send in their offerings and tithes. Reverend Sam Kranchi-Akra and Bishop Charles Ajinasari speak about how churches struggled.
Particularly for the small churches, I am aware of churches that have slashed their salaries by 50%.
Some don't even realize that churches have staff other than those who preach. And so the staff must be paid. You are running schools, you are running clinics, etc. And all that takes money.
In April, Ghana's religious leaders also declared 3 days of national prayer and fasting to intercede for the nation. And we here at Joy FM had the privilege of hosting His Eminence, the Archbishop Nicholas Duncan Williams, in our studio.
In this end time and in the time we live in, God will allow it to turn men to himself.
Michaela, nice report there. Now, COVID-19 also birthed Ghana's first infectious disease center, built by the COVID-19 private sector fund in collaboration with the Ghana Armed Forces. The 100-bed capacity has been in operation since January this year and seen close to 112 cases with 10 lives lost. Here's Dr. Joseph Oliver Kome talking about how what could have happened if we did not have that infectious disease center.
Our mortality rates, our avoidable deaths would have gone high. There'll be too much stress on Kolebu. Rage wouldn't have been able to help because they wouldn't have beds. 37 was helping, but then they'll be overstretched. Nyaho will struggle more than is struggling now. So this facility came in to more or less help calm the waters. And I must say that even with this facility, we're still stretched. If it hadn't been here, we would have had a horrible story. Today is for COVID, but because it's an infectious disease center, I know that very soon, if there are other pandemics, Ebola will bring it here, yours will bring it here. And I really want to thank the people of Ghana because through the private sector fund, they donated money and want to assure them that their investment will be looked after well.
We can now hear from the chairman of the Ghana COVID-19 response program, Dr. Anefi Asamoah, explaining why your incessant appetite for meat could be a factor for the spread of the virus.
75% of all infections are transmitted from animals. In other words, they are animals, agents of infection, that jump to now infect human beings and develop the ability to also move from humans to humans. 75% are from wildlife, and 75% of these animals are monkeys, bats. So in simple terms, we are seeing all these new infections because we as human beings are encroaching and invading the habitats of wildlife as a result of mining, deforestation, road construction, hunting, and the increased trade in wildlife. Bats who used to live in caves now roam in cities. The 25% of infection that's not from wildlife is from livestock. Increased population demand for proteins. So one cannot help but conclude that future pandemics are inevitable.
Chairman of the Ghana COVID-19 Response Program, Dr. Anefi Asamwaba, hashtag COVID a year on. It's time for sports with Hans Mensando. What do we have, Hans?
Can you chew butt?
You don't know.
Would you?
No, but
or monkey?
It's a delicacy, master.
My word.
If you don't know, you don't know. They said they put it in the soup. You just put it on the fufu. You press the stomach and the soup will come out. Give me sports.
Well, I mean, COVID has affected every facet of our life, and sports certainly has not been spared the impact of COVID-19. A year on, we hear from the Ghana Swimming Association on how COVID-19 has affected their activities. Farida Idris is the treasurer of the Ghana Swimming Association.
COVID has really affected swimming activities. You know, all sporting activities were put on hold until the latter part of last year, where the president made all contact sports to start their activity. For the national team, we are yet to start training, and so those currently here, that's the clubs. Not much patronage really, because the decision of some swimmers to come and train regularly as they used to do is under the prerogative of their parents. And so if their parents are still not okay to let their kids come and swim, certainly it will affect the numbers. And so, but all in all, swimming activity has started, and then training is ongoing at the various clubs.
Farida Idris, who is the treasurer of the Ghana Swimming Association, and in sports.
Thank you very much, Hans. I'll take you to Parliament now, where there are preparations for the 2021 budget. But ahead of that, the House has been briefed on the situation in the Palm Beach disaster. We're told that one more survivor has just died, bringing the number to 13. Parliamentary correspondent Parker Wilson joins me on the line with more details. Parker, what are the details? Hello, Parker.
Hello, MFR.
I'm asking for the details on the beach disaster.
Right, so the Interior Minister has been contributing to the statement by the Goma West MP. For him, he's not happy with comments that the children were there engaging in some undesirable actions which anger the gods. He wants people to refrain from such comments and rather assist the police in investigating what really led to their demise.
A group of young people between the age of 10 and 17 years who had thronged the Palm Beach to swim, in defiance of several warnings, were hit by an unexplained misfortune, leaving 12. As of yesterday, Mr. Speaker, the report was 12. But this morning, when I went to my constituency, we recorded a new death. So now the number is 13.
So, Parker, that's the Gomwa West MP updating Parliament on it. I know that other MPs have also been contributing in terms of what should be done at our various beaches. What have they been saying?
Yeah, so the Puziga MP is also not happy about the comment going on for her. She wants government to deploy rescue teams to these beaches, even though they are closed, so that when people smuggle themselves to go and swim, at least they could prevent them. And then the Interior Minister has also been assuring of government support to the bereaved family.
And let's talk briefly about preparations ahead of the 2021 budget. What has the House been doing?
Well, so far the House is currently debating the address delivered by the President on Tuesday. What has been dominating is the shooting incident that characterized the December 7 polls, and also in quoting the minority, the forced retirement of Mr. Domelevo. So the debate is currently ongoing.
That's parliamentary correspondent Parker Wilson there with details. And Mamesi Nyamiche Thompson joins me with what's trending on social media, what people are talking about. Mamesi, what do we have?
Yes, MFR, and COVID a year on is the top trend on Twitter. And we have here Creative Effect saying, when we recorded our first case, I saw some lady crying. I got closer to her and asked what was the problem. She replied, corona anti, mawari area Ebese. I was like, seriously, some ladies, hashtag COVID on. We also have Fifi Yabwa saying, a year on today, Ghana was getting prepared for a lockdown, hashtag COVID, a year on. Kojo Prempe is also saying, a year ago, these sanitizers were selling for 50 Ghana cedis. Do you remember? Yeah, face mask and then sanitizers had gone up crazy. And then we also have Nana Yao also saying from South Korea, saying South Korea and Ghana got it right in handling coronavirus, and Brazil, the UK and India got it wrong in handling the virus. Hashtag COVID a year on.
Thank you very much, Mami Sinyamiche Thompson. And what's trending also on myjoyonline.com, the stories that people are going to is woman dies in hole after boyfriend allegedly assaulted her. We also have Manasseh Azuria, Winnie Domelevo, Al Hassan, and the soldier, among several others. You want to visit myjoyonline.com for more news. Living Word with Pastor Menzel Tabil is up next. I am MFA Pau. Thanks for your company.